Everybody, according to the American Heart Association, every day in Texas, 74 women die from heart disease or stroke. It is the #1 killer of women. Despite the severity of the problem, a majority of women don't realize that heart disease is the major health threat and are unaware of the symptoms that show their cardiovascular risk. With us today to talk about this subject is Dr. Beth Cishek. She's a cardiologist at the Seton Heart Institute. Thank you so much for being here this morning.
You're very welcome.
Why do women not recognize the symptoms of heart disease?
I'm not sure it's so much that they don't recognize the symptoms as that I think a lot of women believe that it won't happen to them, especially younger women who may not perceive their own risks as they're developing throughout their lifespan.
What causes heart disease?
The major risk factors, of course, are smoking, diabetes, hypertension, immobility, family history, which we can't do anything about, and heart disease tends to appear or progress as women age.
When does it start? When should women start paying attention and making a change in their life or their routine?
Well, today is the simple answer.
Never a better time to start.
But, you know, we see a rise in women in heart attacks right after menopause. There's been a recent reissuing of guidelines for prevention of cardiovascular disease in women, which actually also looks at early risk factors that many of us don't think about. So, especially in pregnancy, for instance, women who have developed pregnancy-induced hypertension or gestational diabetes, even though their blood pressure may go back to normal or their blood sugar may go back to normal following delivery, that's an early risk marker. And we see those same women later having abnormal stress tests, et cetera, et cetera, et cetera. So early on, there are certain features that are very compelling risk factors which are modifiable.
And of course, diet is modifiable. Talk about that and the importance of eating correctly. It's hard to eat right.
It's really hard to get all those 5 servings of fruits and vegetables every day.
Yeah.
And the new guidelines, they're actually the re-emphasized guidelines for 2 servings of fish every week. And those kind of things are difficult to do, but they're doable.
By the time patients see you, is it too late?
No, absolutely not. There's a lot of data looking at regression of atherosclerosis, which is making the plaque regress literally within the arteries, and really the same things that prevent plaque buildup can induce regression of that atherosclerosis also.
Is menopause starting earlier now in women, or is it about the same age that we've always been told?
It's about the same age, so early 50s, very late 40s. There's a very strong genetic tie to what the age of menopause will be.
And when patients see you, what is your advice to them?
Regarding
just being healthier and taking care of your heart. What is the main advice you give them?
It's very interesting if you look at the data of women and men. For instance, the traditional ways that we treat heart disease in men, angioplasty, stenting, bypass surgery, the data for successful outcome in women for those types of treatments is really not quite as good as it is in men. But if you look at, there's been several studies now that suggest that the risk modification and the prevention actually may work better in women than in men.
Oh, well, that's good, is it? I think it's good. If you need to make an appointment with Dr. Cishek, you can call her at 324-3440 or go to their website at setonheart.com. Thank you so much for being here.